Hello guys, welcome to Dr. Science. So today our topic is about acute mastoiditis. Now what is meant by mastoiditis? Mastoiditis is nothing but when there is infection of your air cells in the mastoid. Okay, that is known as your mastoiditis. Now we will try to understand this by drawing a small diagram here. So this is the external pinna and this is the external auditory canal, which will eventually fuse with the tympanic membrane. The tympanic membrane is closely attached to your middle ear. Now this middle ear and the nasopharynx, as you can see here, this is the nasopharynx. The middle ear and the nasopharynx are connected through a tube. Now this tube which is connecting your middle ear and the nasopharynx is known as your eustachian tube. Now imagine there is infection of the nasopharynx. Unfortunately, this guy got cold, and during cold you get the bacteria such as your Streptococcus pneumoniae. Streptococcus pneumoniae is a pus producing bacteria, hence people call it as your pyogenic bacteria. Now this Streptococcus pneumoniae will infect the nasopharynx, and from the nasopharynx via the eustachian tube it will enter the middle ear and infect the middle ear, and this is known as your acute suppurative otitis media. And this acute suppurative otitis media can lead to a complication called as your acute mastoiditis. Now we will see what are the complications of acute mastoiditis by drawing a small diagram here. So this is the mastoid. Inside the mastoid we have hollow air-filled cavities, and these hollow air-filled cavities are your air cells. So inside mastoid we have the air cells. One of the biggest air cell in the mastoid is called as your antrum. And this mastoid is connected to the middle ear. As you can see here, the mastoid is connected through a middle ear via a tube, and this tube which is connecting the mastoid and the middle ear is called as your adytus. Okay, we will draw the nasopharynx also. Here is the nasopharynx, and what was the tube that is connecting the middle ear and the nasopharynx? It was the eustachian tube. So once again, this guy got infection by the Streptococcus pneumoniae. There was infection of nasopharynx. From the eustachian tube it will enter the middle ear, and from the middle ear via the adytus it will enter the mastoid, and it will infect the air cells which are present in the mastoid. I already told you acute mastoiditis means infection of air cells in the mastoid. As you can see here, via the adytus the bacteria is entering the air cells and infecting them. Now not only that, I would like to say that suppose this is the antrum. Usually the air cells are lined by a mucosa layer. Now if there is any infection in the mucosa layer or any infection in the air cell, can lead to increased pus formation. That's why people call it, during mastoiditis there will be profuse pus production. It means the pus is produced constantly. Suppose I try to clean it with I took a cloth and I cleaned the ear of the patient, but within 1 or 2 seconds again there will be profuse ear discharge, because there is a lot of pus coming, and eventually even if you clean also the ear discharge will be continuously formed. Hence this is known as your reservoir sign. So in reservoir sign there is profuse ear discharge. Even if you clean it with a towel, there will be ear discharge which will form there within seconds. Okay, this is known as your reservoir sign. Imagine like from the reservoir there is continuous flow of water. Similarly, the pus is continuously flowing. This is called as your reservoir sign. Now what are the investigations? The investigations are your X-ray mastoid, which is your Sculler's view. Okay. Aside from that, what are the clinical signs of this patient? The first one was your reservoir sign. I already told you. There will be profuse pus formation. The second one is your ironing of mastoid surface. Now what is this ironing of mastoid surface? We have to see the small diagram here. As you can see here, behind the ear there is a bulge. Behind the ear there is a huge bulge, and this bulge, when you see it, it is appearing like red, smooth and shiny bulge which is present behind the ear. This is known as your ironing of the mastoid surface, because the mastoid is present behind the ear, and if there is an infection in the mastoid, obviously the mastoid will get swollen up as if someone put a iron there. Okay, hence this is known as the ironing of your mastoid surface. That is one of the clinical feature of this patient. Now what is the treatment in these patients? Treatment, usually we give IV antibiotics, and we give this IV antibiotics for 48 hours, and if the antibiotics fail, we will do a surgery called as your squat surgery. Now what is meant by this squat surgery? So here is the mastoid, and this mastoid is going to contain a lot of air cells. One of the biggest air cell is your antrum. Unfortunately, this antrum is filled with a lot of pus inside because of infection. So what we will do, we will put a drill. Okay, we will put a drill inside the antrum, and we will put a drill and keep a hole in the antrum, and we will drain it. This is known as your squat surgery, or also known as your cortical mastoidectomy. Now what is meant by cortical mastoidectomy? So the inner is your medulla. The outer layers where the air cells are present are called as your cortex. So we call it as your cortical mastoidectomy, where we will drain the air cells. I hope you are clear with it. Now we have to know, how do we locate the antrum? Because antrum is one of the largest air cells, so obviously we have to drain the antrum first. So how can we locate this antrum? So usually, suppose this is the nose of the patient, these are the lips of the patient, and this is the eyes of the patient, this is the head of the patient. So here is your external auditory canal. Behind the external auditory canal there is a triangle, and this triangle is known as your suprameatal triangle. So suprameatal triangle, below the suprameatal triangle we have the antrum. So if you look during the surgery, we locate for the suprameatal triangle, and below the suprameatal triangle itself we have the antrum. So that's how we locate the this antrum. Now before ending the topic, I would like to talk about the corner septum. Now what is meant by this corner septum? Corner septum is nothing but the remnant of petrosquamous suture. We'll try to understand this by drawing the diagram here. So this is the mastoid. Let's draw it clearly. So this is the mastoid, and inside the mastoid we have the antrum, which is the biggest air cell. Now on this mastoid process we have some cells. These cells are your petrosal cells, and not only that, we have this cell which is present here, and these cells are your squamous cells. Now in between the petrous and squamous cell there is a suture, and this sutures which is present in between the cells is your petrosquamous suture, or also known as your corner septum. Now why this is important? I already told you, during squat surgery I usually locate the antrum by going through the suprameatal triangle. But unfortunately, this corner septum is an anatomical variation. What is meant by an anatomical variation? Imagine all the humans on the earth have 5 fingers, but some people have 6 fingers. These people who have 6 fingers are called as your anatomical variants. Similarly, when I go for the squat surgery, I go through the suprameatal triangle. But people who have corner septum, we cannot locate this antrum that easily because they are having a remnant of the petrosquamous suture. So it is difficult to find the antrum in people who are having the petrosquamous suture or the corner septum. So that was about it, guys. Thank you.